So this is just a graph from 2000 to 2007 showing you the valley fever rates in individuals greater than age 65. And you can see that over time, since 2000, the rates among individuals over 65 have definitely been increasing. So when we did our enhanced surveillance investigation, our goal was to evaluate Arizona's coccidioidomycosis surveillance system to identify issues contributing to delayed diagnosis and underreporting, and to measure the impact of coccidioidomycosis on Arizonans. We really wanted to be able to show the legislature, clinicians, people who may have some money to develop a vaccine, that this was a significant disease, that it was Arizona's issue, and that we really needed to put some effort into it. So again, the methods were that we telephoned every 10th case. Interviews were conducted using a standardized questionnaire, and after 3 attempts, that subsequent case was contacted. So to tell you a little bit about the Coxie case definition, and I don't want to go into this too much, basically CDC and the Council for State and Territorial Epidemiologists get together to decide what we're going to call a case of Coxie in public health. That definition, with some help from Arizona data, was actually updated in 2007. And before that time, Coxie was treated like a typical infectious disease where it required a rise in serology, rising titers over time. And that's just not necessary for Coxie. If you have a single serology result in Coxie that is positive, whether it's IgG or IgM, it generally indicates that you have active disease. So we were able to change the definition that an isolated IgG or IgM did count as a case, not just in Arizona, but nationally. So since 1997, Arizona has done something unique. Because we have so many more cases than the rest of the country, we have actually not required the clinical symptoms to be met. As long as they had a positive serology, they were counted as a case of Coxie. So we just used the lab criteria. And part of the reason we did this enhanced surveillance was because we wanted to make sure that that was a reasonable approach, that there was enough Coxie here that if you had a positive lab test, that it meant that you more likely had Coxie. Even if we weren't looking at the clinical symptoms, we wanted to know in this sample at least what percentage actually had a clinical syndrome consistent with Coxie. So we interviewed almost 500 cases, and what we found was that 95% of Arizona cases that we interviewed actually met that clinical case definition. And only 3% of cases reported no symptoms at all that were consistent with Coxie. So what we found is that even if you don't look for clinical symptoms, don't take the time to get the medical records, 95% of them among this pretty large sample actually did meet the clinical case definition, and that validated our current surveillance system. We learned that the common symptoms of valley fever, which is consistent with the literature, the most common symptom, 84% of cases reported fatigue. And you'll hear that all the time. People will be like, oh, I'm not sick, but I just feel like a truck hit me. I couldn't get out of bed. Those kind of things. Unfortunately, that's not enough to meet the clinical case definition, but that is the most common symptom. 67%, about 2/3, had cough. 60% had shortness of breath. And interestingly, 54% of reported valley fever cases actually had fever. So I think that's difficult for clinicians who think of this disease as valley fever. They think, well, if you don't have a fever, you don't have the disease. Well, about half of folks who have this disease don't have a fever. And then the other thing I want to highlight down toward the end, see if, is that pointer coming up there? Great. Is I want to highlight rash. About 34% of folks presented with rash. That's pretty high. And hopefully we'll present enough data today that, based on a study that Dr. Blair did, that'll convince you that if somebody presents with community-acquired pneumonia and a rash, that should always make you think of Coxie when you're practicing in the Southwest. So the impact on the healthcare system, almost half of the people we interviewed went to the ER for their valley fever. Over 40% were hospitalized overnight for their disease, and about a quarter saw their doctor at least 10 times during the course of their illness. I think a lot of the public, and maybe even some clinicians, think that valley fever is just like having a cold or the flu. But a lot of folks have really severe and prolonged disease, and I think these data really help show folks that. What we learned was that 23% of people with valley fever first sought care for their symptoms in an emergency department. And that told us that we needed to get the message out to ER docs to be thinking about valley fever so that they could order the test. And any of you that have worked in an ER or know what an ER's life is like, it's not that easy to order a test that you're not going to be able to follow up on that night. So that's a little bit of a struggle. But what we're hoping is that hospitals will support ER docs in ordering the test, and that there'll be a good mechanism to follow up on those tests and let patients know their diagnosis after it comes back. So from the hospital discharge database, we learned that 70% of inpatient visits for cocci actually started in the emergency department. That was another clue that we really needed to reach ED physicians and talk to them about diagnosing cocci. So regarding the impact, looking at duration of illness, cases were sick for an average of 6 months or a median of 109 days. That is a really prolonged illness. That wastes away mononucleosis, which I used to think of as a primary care clinician as one of the most difficult diseases for people to get through regarding fatigue. Cocci is way worse. 75% of cases reported missing work due to cocci for an average of 1 month and a median of 2 weeks. 75% were unable to do their usual daily activities, and that was for an average of more than 3 months and a median of a month and a half. So that's significantly life-changing when you look at the effect that this disease had on people. So looking at the data from 2007 from the hospital discharge database, which actually collects the discharge diagnosis by administrative code for every single inpatient discharge in Arizona, we found that there were 1,735 cocci-related hospital visits in 2007. This accounted for $86 million in hospital charges with an average of $50,000 per hospital visit. So again, this is pretty costly for the economy in Arizona and for the healthcare system. We also learned that cases waited an average of 44 days before seeking care for their valley fever. The average time between seeking health care and getting diagnosed was 5 months. But in a separate study that we did amongst, actually in an additional question that we asked them, whether they knew about valley fever prior to their diagnosis, we found that those who knew about the disease prior to seeking health care were much more likely to be diagnosed and treated earlier than those who had never heard of the disease. And that was 79 days compared to 282 days with a significant p-value. So that let us know that we really needed to educate the public about valley fever too, because they were actually huge proponents in getting their docs to diagnose them. We also learned that a mean of 3 provider visits occurred before cocci diagnostic testing was ordered. And that's actually a median of just over 2 visits. So there's another survey out there that Public Health does routinely every year, the Behavioral Risk Factor Surveillance System. And that's where we were able to ask the general public in Arizona a few questions about valley fever. And it is designed to represent the entire population of Arizona. What we learned is that 1 out of 5 Arizonans have never heard of valley fever. 60% believe valley fever is a significant health problem. 40% don't think it's a big deal. And more than a third of the general public don't actually know how valley fever is transmitted. So that told us we had some work to do with education. Length of time lived in Arizona. The average for the entire population was 26 years. 25% had lived in Arizona for less than 10 years. When we looked at our enhanced surveillance data, so all those individuals who had been diagnosed with cocci, The average that they had lived in Arizona was 16 years, and 40% lived in Arizona for less than 10 years. And while that is a significant difference, I think it actually dispels the myth that the majority of folks who are diagnosed with cocci have only lived here a short time, that they just got here, they were just exposed. Many people do actually get diagnosed years, more than a decade after they've been living here. So that's not really helpful for a clinician to ask how long you've been living in Arizona. I wouldn't discount someone just because they've lived here 25 years. They can still have a new